Hello everyone. Today I'm going to talk about anxiety. Anxiety is a very common ailment that happens to many of us from time to time. Now, anxiety could be due to the present situation, that is COVID-19, or anxiety could be due to the many different kinds of situations and many different kinds of risks and many different kinds of turmoils that we face in our lives. So anxiety is very much a part of our lives, and many a times we face anxiety in our lives. So those who face anxiety and those who are facing panic and anxiety at this moment of time or at other moments may benefit from this video. Now first we are going to talk about what are the symptoms of anxiety. The first symptom of anxiety is worrying, being anxious, hypervigilance, irritability and restlessness, lack of concentration, racing thoughts or unwanted thoughts, overthinking, fatigue and sweating, palpitations, tension, and unable to get your thoughts out of your mind, thinking about it constantly, being engulfed by fear of something, maybe some kind of risk, some kind of danger that you are in. That is anxiety, an unnecessary worrisome situation. So those are the symptoms of anxiety. Unable to sleep, difficulty in sleeping, difficulty staying asleep. So these are the symptoms of anxiety. Now once you have anxiety, how do we deal with the anxiety? Many people often come to me and say that, ma'am, I'm feeling anxious. I'm feeling anxious about this, anxious about that. I'm feeling anxiety. I'm feeling symptoms of anxiety. I have Googled it. I feel that I have symptoms of anxiety in me. So how do I deal with anxiety? Now, we all know that our thoughts direct our behavior. It is basically our thoughts that direct our behavior. Now, if there is some wrong pattern in our thoughts, then definitely our behavior is going to be different. Our behavior is going to be wrong. So the first thing that we need to do is think that, are we thinking in the right way? Are we thinking in the right way, and whatever we are thinking positive or are we thinking negative thoughts? So it is, are we bringing our anxiety ourselves? Are we thinking negative and are we bringing our anxiety ourselves? Do we have negative thoughts in our mind, and because of which our anxiety is killing us? So we have to identify the triggers. We have to identify the triggers that enhance our anxiety, that bring out the anxiety in us. So we have to know maybe somebody said something to you, or maybe some situation, or maybe some kind of insect, or some kind of animal, some kind of risk that you are supposed to take, or some kind of situation, some kind of event. All these kinds of things may be giving you anxiety. Maybe like this, in this situation, like in this COVID, many people might be anxious that I might be having COVID. So I will not go out, I will not do this, I will not touch that, I will not do this. Of course, it is definitely important to maintain all the safety and social distancing and staying safe at home. But if you unnecessarily worry that I am going to be affected with COVID in spite of taking all the precautions, and unnecessarily killing yourself thinking that I'm going to have COVID, and constantly watching TV and constantly thinking that this is the death toll is rising, I am also going to be one of them. So this is anxiety. So in that case, you have to identify your negative thoughts. That is the first step. And you have to slowly and with baby steps, you have to change your negative thoughts into positive thoughts. So you have to change your thinking pattern. It is basically our thinking pattern that we do not realize in our subconscious mind that changes how we think, and from the way how we think, we behave in the way possible that creates depression, anxiety and all these kinds of things. So what we need to do is nothing very big or nothing very challenging. We need to be aware. We need to be aware of how we are thinking. Maybe there is some change in the structure of the thoughts that we need to do. So we need to change from negative thinking to positive thinking. The next step that we need to do is that we need to practice deep breathing. Whenever you feel bouts of anxiety, whenever you feel anxious, you need to practice deep breathing, inhaling and exhaling. I'm going to show you. Like this, you are going to practice deep breathing, inhaling and exhaling as slowly as possible, and deeply inhaling and exhaling, counting 1 to 10 and 10 to 1. So this will give you some relief, and trying muscle relaxation. So this will reduce your anxiety to some extent. The third step that we need to do is you need to challenge your negative thoughts and do a reality check. You need to find out, are my fears real? Am I thinking whatever are my fears, are my fears real? Do I have evidence to support it? Have I been really affected by COVID? Have I been really affected by any kind of danger, any kind of risk? Is there any evidence? So I have to do constant reality check. So what happens is, generally in patients with anxiety, they go from people to people and to close people, and they constantly go on asking for reassurance. So this is a very common practice of people who suffer anxiety. Now here you need to have 1 or 2 people with whom you trust. Either it is your therapist, or it is your friend, or it is your relative, whomever you trust and whomever you can depend on. And then you can definitely depend on that person and ask him to help you out, but you need not ask for constant reassurance. So you need to do a reality check that really, am I affected with COVID? Is there any symptom? You should not be living in constant fear of thinking that I am getting affected with COVID, or I am getting affected with this kind of disease, that kind of disease. So because of nowadays lifestyle changes, many people have, because of pollution, because of lifestyle changes, many people have different kinds of fear nowadays. I'm going to have cancer, I'm going to have heart disease, I'm going to have kidney disease. So many people live in the fear that many people have this thing like, I'm going to grow fat. Most of the women, they have this body idea about themselves that they are fatter than their actual selves. So this is also a kind of anxiety. So what happens is that you need to think, you need to do reality check. Is it real? What am I thinking? Is there any evidence to support it? So that is another way of checking your anxiety. The fourth thing that you need to do is distract your mind. Now this is easier said than done. Distracting your mind means that people will often tell you that whenever you feel tensed up or whenever you feel depressed, distract your mind, do something else. But that is not easy to do. For a person who is suffering anxiety, his mind, his or her entire mind, his entire heart, his entire concentration is full of that thought. So it's very difficult for that person to do something else at that moment of time. So that kind of advice can be easily given, but it is very hard to practice that. So what you need to do at this moment of time, by distraction, what we mean is that you have to distract yourself with something that is so distracting, that is so attractive, that is so strong, that you can actually take your mind off from your anxious thoughts and get into that work. Like supposingly you like dancing or singing or painting or cooking or gardening or whatever you like doing, distract your mind, get into that job and start doing it. You have to actually physically start doing the job. Instead of just thinking and imagining that I am going to distract my mind and I am trying but it's not happening, you have to actually give an effort to do it. So the stimuli of that distraction should be so strong enough so that your distraction works. So you have to find your own distraction. It is not possible for anyone to give you that clue that what would be your distraction. You have to find your own distraction. Whichever stimuli works for you. The stimuli has to be strong enough for you to distract your mind from that anxious thought and get into something else, so that your mind is not preoccupied and not fully occupied with that kind of anxious thoughts. So these are the 4 tips. Other than that, there is another time-tested method that we all keep doing is meditation. Meditation is very important for everyone, not only for patients of COVID or not only for people who are suffering from anxiety, but for everybody. So early in the morning, get up early in the morning. If not early in the morning, even in the evening, you can also do that. Practice meditation. Meditation is a very time-tested technique of concentrating your mind and controlling your mind. So initially, in the initial phases, when you sit down for meditation, you will see that you will feel restless. Your mind will not be able to control your mind, and you will feel restless. But at least try to do it and try to sit and maintain the meditating thing for a couple of minutes, at least for 5 minutes, then 10 minutes, then 15 minutes, then 20 minutes, increase it to 20 minutes, then 25 minutes. This way, slowly increasing as much as you can do. Now, one method of meditation is counting from 1 to 100 and 100 to 1 backwards counting very slowly. 100 to 1 backwards counting very slowly, if you can do it. So that is one method of meditating, and that is the starting method of meditating. Now slowly concentration, you will build up your concentration, relax your muscles, calm your mind, and think that you are in a better place, that you will be able to do it, and you can do the meditation if you want. So don't become fidgety and don't become restless and get up from the meditation and say that I can't do it, it's not happening to me, so just leave it, it's very boring. So don't do that. Meditation has a long-term benefit, so you should practice meditation once a day at least. Now, what I wanted to say is that all these things, whatever tips I have given, it's very easy for anyone to narrate this to you. But it's very difficult for a person suffering with anxiety to practice all these things. But other than having medications in case of very serious anxiety disorders, or having a sessions with therapists, if you are facing anxiety, you can practice these tips. But the most important thing in any kind of situation, if you are feeling anxious, is that you got to give effort. Effort is the most important thing. Sitting and dreaming about it and thinking that my anxiety will go away, it will vanish on your own, will not happen. You have to give effort. So effort is the most important thing in anything that you do. and practice. So remember those things, and next session I might be talking about depression and the other issues, other psychological issues that are there, and we will see that if maybe few people may benefit from this kind of videos. So I'll be keeping on doing videos, and if you like it, kindly share. Thank you.